The U.S. Navy hospital ship Comfort has now pulled into port here in New York City with 1,000 beds to help overwhelmed hospitals. A field hospital has been built in New York's Central Park for patients with coronavirus. The virus spreading into the heartland amid disturbing images of large groups in defiance of those orders to stay at home. In a moment right here, New York's Governor Andrew Cuomo joins me on the new numbers just out from New York City, the death toll. The numbers are alarming tonight. We asked, do healthcare workers have the supplies, the protection they need as they fight this? We'll ask the governor in a moment as the number of deaths in the U.S. now tops 3,000. Tonight, across this country, the grim images. In New York City, a body loaded into a refrigerated truck outside this Brooklyn hospital.
Please stay inside. Please pray for the people.
New York City bracing for a mounting death toll. More than 1,200 lives lost, 250 lost in just the last 24 hours.
We've lost over 1,000 New Yorkers. To me, we're beyond staggering already. We've reached staggering.
Just today, the Navy hospital ship Comfort pulling into New York Harbor. The 1,000-bed facility ready to take on non-COVID-19 patients to relieve the pressure on the city's overwhelmed hospitals. And in the heart of Manhattan, a new field hospital specifically for coronavirus patients set up in Central Park. As New York is pushed to the brink, the president's own team now warning the potential U.S. death toll could soar as high as 100,000 to 200,000 in this country.
I think it's entirely conceivable that if we do not mitigate to the extent that we're trying to do, that you could reach that number.
And tonight, President Trump has now reversed his hope to reopen the country by Easter, now extending social distancing guidelines to April 30th. This is what the president said just tonight.
Challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line, this 30 days.
Doctors across this country struggling to help families unable to visit their loved ones, kept from the ICU for fear they would be infected too.
We make it a point to call families twice a day, but I can't imagine being that person on the other end, having to wait for that phone call, never knowing what sort of news you're going to get.
An emotional toll on nurses who are so often the critical link between a patient alone in the ICU and their family.
I just came from a patient's room. He's actively dying, positive diagnosis of COVID-19, and his family can't come, so I had to FaceTime his family, and it was just so heartbreaking.
911 call centers stretched thin too. In New York, a record 6,000 calls in one day. First responders have been hit hard too. About 5,000 members of the NYPD are out sick. More than 900 officers and 260 firefighters testing positive for coronavirus. Cities including Chicago and Detroit watching cases spike too. This convention center in Detroit will be turned into a 900-bed hospital. And in Philadelphia tonight, this arena at Temple University will be transformed into an overflow hospital after cases there have topped 1,000. And tonight in Los Angeles, the Navy Hospital Mercy already taking on extra patients to ease pressure on the hospitals. And this virus is hitting doctors and nurses on the front lines too. Dr. Arnold Wegg believes he contracted the virus through a patient's cough.
My father is truly in the fight for his life.
The doctor is a 63-year-old grandfather of 6 and marathon runner. He's now in intensive care for the first time as a patient.
Yesterday was my parents' 38th wedding anniversary. And this is the first time they couldn't spend it together.
Tonight, hospitals across this country are reporting drastic shortages of masks and protective gear. A national survey finding 88% of cities do not have an adequate supply.
I have nurses that call me on a daily basis to tell me that they're scared, to tell me they don't know what to do. We didn't sign up for this.
Mary McDonald recording this video saying it's not just supplies, it's basic medication.
We're out of Tylenol. We're out of Tylenol. I don't know what I can do to save people anymore.
And tonight, California officials are now warning that they're on the verge of a spike too. The state has at least 5,700 cases. And in New Orleans, for the first time since Hurricane Katrina, The convention center there now transformed to deal with an unfolding catastrophe. Over the weekend, cases in Louisiana jumping from roughly 2,700 on Friday to more than 4,000 today. Stunning to see the convention center prepared for something like this all these years later again. Tonight we are hearing from the front lines, America's medical heroes sharing their stories, the doctors, nurses, the healthcare workers fighting this battle, risking their lives to save others, some separated from their own loved ones and fearful, of course, that they might bring the virus home to their families. Here's ABC's Matt Gutman tonight.
I love you. I love you too. Never did I ever think that I was going to be on the front lines fighting a war. I shaved my head as a rally cry, as a personal reminder that this is life and death.
It's incredible, the degree of illness.
Dr. Ed Lathan is one of the thousands of doctors and nurses who are part of the battle against the COVID pandemic. Lathan says those harrowing images posted on Facebook of an overcrowded ER at Jamaica Hospital in Queens have been mirrored at hospitals all over his area.
It's been 17 hours since I got here this morning at 7 o'clock. I arrived, there's been no ICU beds. We've had multiple resuscitations and intubations. Patients are critically ill. You don't have opportunity to sit down, to eat, to drink, barely to go to the bathroom.
This virus has affected everybody. And so I'm sleeping in the garage because I don't want to bring the enemy home with me. We bring them to our ICU, we put them on the ventilator. The problem is that every single COVID patient that we get isn't leaving. Every patient is still on the ventilator, still incredibly ill. That's another bed, another nurse.
And the nurses, they're afraid. I don't want to bring it home to my kids. I don't want to bring it home to my family.
The most disconcerting thing is that we're losing staff members. Our nurses are sick.
But despite that risk, everyday nurses are still answering the call to deal with the flood of COVID patients.
Right here,
like at this LA hospital.
This is beginning the check-in process for patients that will drive in. Nurses are ready, geared up, and ready for whatever's to come. So this is our ICU. So I'm just getting to my car now after a long, almost 14-hour day.
But the intensity of the long hours take a toll.
8 years ago, I took on an oath to care for patients, and they're dying alone in a hospital room without family, and then their families are grieving alone because they're on isolation. It hurts.
In Georgia, nurse Carly Rice told us about a FaceTime call she had with a dying patient's family who were unable to see their loved one in person.
It's so hard to sit there and hold your patient's hand while their family members are sitting there telling them they love them, and it's not goodbye, it's see you later.
It was just an amazing connection, although it was just FaceTime. Nurse Carly grabbed Grandma's hand, and Grandma started to squeeze her hand. I started to say, well, I love you, I miss you. Nurse Carly is amazing. The world needs tons of Nurse Carlys.
You couldn't fix it, but you certainly gave the family maybe a little bit of peace.
I hope so. I really do. I pray about it a lot, but it still wears you down.
Families are put in such a difficult position right now.
So what keeps you going every day? I mean, this just sounds like it's so utterly depressing.
My patients, honestly, just today, as we are rooting on our patient as he was going to be extubated, our first COVID patient to be extubated, meaning the breathing tube taken out, and we're giving him thumbs up and we're dancing in front of his room. And I mean, that's what keeps me going.
First COVID extubation.
The best moment is when I get home to see these little monkeys. Hi.
I can't touch her, remember? How's your day?
Okay, but I can't get close to you. Let me go change, okay?
It's a difficult time, but we're rising to the challenge, and we're going to stay in this until we can defeat it.
We cannot forget our healthcare workers, and when you see those parents go home and they can't even hug their own children until they get that gear off. Matt Gutman, our thanks to you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.